The truth about staph infections. So very often, staph infections have become very prevalent in the hospital settings. MRSA is a very highly looked at staph infection that is developing across our country. It was first discovered back in the 1960s, and it was linked in with nosocomial infections, patients who had known weak immune systems, who were apt to get any type of infections, who've had long-term intravenous lines or Foley catheters that were in. Now we have what's called community-acquired infections, which are known facts that are occurring, but unfortunately the risk is still developing in the hospitals. What we're seeing is that more and more people are coming in having surgery and different type of diagnostic tests, and who are developing MRSA. Little known fact is that the fact is a lot of these patients is not hospital acquired infections at all. A lot of them are community acquired infections. In my mind map, I developed a patient who came in for a simple laparoscopic procedure. As a matter of fact, she came in for a laparoscopic cholecystectomy for the removal of her gallbladder. In the event of the course of her stay, she developed an abscess, and the abscess drainage grew out MRSA. So we think. Looking at the situation at whole, hospitals are getting hit very highly on these infections for the fact of bills are being wiped out completely or even decreased due to these infections. Research is showing that people present all the time with community acquired infections, whether it be a rash on the skin, a boil, a pimple, and this does not have to be a weeping wound for these infections to be known. In other words, a lot of times our hospitals are losing money due to the fact of being accused of these infections when it's not them that have given it to the patients at all. We have noticed that poor hygiene plays an important role on whether a patient would do well or not, especially when it comes to a compromised situation such as surgery. We have to remember that proper hygiene is the most definitive mechanism in the prevention of any type of infection.